In terms of stigma and various diagnoses, sometimes there's more stigma attached to a diagnosis of schizophrenia than, say, a diagnosis of depression. Everyday people will say, "I'm depressed today." So if you have and they have some sense of what depression is, not serious clinical major depression, but it's sort of a casual reference. And so someone who has serious depression, there's not as much stigma attached to saying, I have depression and I take antidepressants. But somebody who has schizophrenia, to have to say, I take antipsychotics medication, and it's not common to hear someone say, "Oh, I'm hearing voices," or "I'm hallucinating." These are the kind of things that sometimes accompany schizophrenia. Not always, but they can, and it's more. It brings a more serious image in someone's thoughts to think about that. We use what we call people first language. I'm someone that lives with schizophrenia. I'm not a schizophrenic. I have bipolar disorder. I'm not bipolar. There's a whole list of words, that vocabulary words, that we begin when we work with someone to extinguish those words from your vocabulary. Psycho, whack job, nutcase. They're very derogatory, and they perpetuate that stigma that makes people shy away from seeking treatment.